I wonder why I can't see. That's so weird. I usually can. All right. Well, this is how it goes when you have, let's see, sharing screen. Oops. Oh, I see. So down here, I mean, you're gonna have to do. You're gonna have to do that. So maybe. Hey, there everybody is. All right.
Can you see yourself?
Yes. Everybody? Yes. So it'll come up as Kelly Donatello, but Irina Serebryakova, of course, is going to be doing the presentation. She's our wonderful nurse practitioner that's been practicing holistic women's health for how many years? 15 years. So it's nice. She blends traditional medicine with holistic medicine to really help people overcome chronic issues, especially, you know, hormones that she's going to talk about. So yeah, it's just 5 o'clock. So what I'm going to do is do the full screen. And I also want to make sure that we're recording everything. So yeah, I think we're good.
So it's recording?
Yes. Yes.
Okay.
All right. So, and then you can just go back if you want to. Okay. Perfect.
Hello, everybody.
Hello.
Hi. Can you see me? Can you hear me?
Yes.
Okay. Hello. Thank you for joining us on Zoom this evening. And I will be talking about holistic women's health. My name is Irina Serebryakova. I'm a holistic nurse practitioner, and I incorporate traditional medicine with a variety of alternative modalities. And as a holistic practitioner, I believe that it's important to address all aspects of women's health: digestion, the immunity, the hormonal status, toxicity. All of those are important in order to bring body into the balance. And what is holistic women's health? I will share with you today a new approach, integrative and holistic approach about women's health, and I will share how to optimize your wellness and your symptoms. I address...
Sorry, I'm just going to play with this while she's talking. Go ahead.
Yes, I address a variety of conditions, and as you can see here on the list, I help women with irregular periods and weight gain and menopause, low thyroid, hyperthyroid, ovarian cysts, allergies, and digestive symptoms. So a variety of conditions can be addressed with natural remedies. It doesn't go to next now, so I don't know what you did.
Oh,
but this doesn't work now.
What's that?
The enter.
Oh, you know, I think we just have to go here.
So I also help women to prepare their body for conception and teach them how to sustain healthy pregnancies. And often hormonal imbalance can actually prevent conception and cause the miscarriages. I would like to share also that there is a different treatments, non-traditional treatments for abnormal pap smears and the HPV. Often human papillomavirus actually resolves on its own with straightening of the immunity, and the surgical treatments such as sleeps and colposcopies are not often necessary. I developed a few protocols on how to heal this condition and improve your immunity. And the menopause, I call it a time of transformation. And let's look at this with the positive outlook. As I tell my patients, the menopause and aging is optional, and suffering is optional. So what menopause unfortunately comes often with some unwanted symptoms, such as hot flashes, night sweats, mood changes, sleeping problems, memory problems, low sexuality, pain with intercourse, and the bone density decline. So how do we correct all those imbalances? And so we have also another concern that often comes with the menopause, perimenopause, as changes in the breast tissue. As we know that the breast cancer grows 2% per year since 1946, and only less than 5% is actually responsible, genetics are responsible. And more we understand that cancer is a disease of the environmental toxins. And unfortunately, we have a lot of endocrine disruptors now in our food, in our environment. And here I want to talk about a few of them, few causes of breast diseases. Compromised immunity when we are exposed to viruses, parasites, or vaccinations for prolonged period of time. The lymph congestion is another one. So lymphatic system is our protective mechanism against all the invasive pathogens or toxins. And unfortunately, when we practice some practices such as synthetic deodorants, metal wires in the bras, the synthetic lotions that have a lot of toxins, all of those things congest your lymphatic system. Also, quality of food is very important. For example, hydrogenated oils contribute to many problems in the system, and we're also exposed to different carcinogens via EMF, electromagnetic fields, heavy metals, and the people who work at night, they're more prone to different breast conditions because of the low melatonin production. And actually, in one of the studies, it's been shown that 47% of people, 47% more people had breast conditions, those that were night workers. And estrogen dominance, this is one of the big problems that was during the perimenopause, because estrogen dominance is a very common problem during that time. Unfortunately, during perimenopause, the women's hormones are not produced in the same pattern. We see excessive estrogen, but lack of progesterone. This is where the name of estrogen dominance came from. And in addition to it, we also have a lot of xenoestrogens in our food and plastic, birth control, and even in fuel. And so those are very important to address, and I help patients to create the treatment plan and how to prevent and improve the condition. Here I want to give you an example of mammogram versus thermography. You're probably all familiar with the mammogram diagnostic tool, but thermography, it's another emerging diagnostic service that is totally based on a different approach. As you can see there, we see some asymmetry in the breast and some red areas indicate increase in temperature. So what we're looking here, we're looking for some hot spots. Hot spots, as a rule, always indicate some kind of abnormal growth. And this is how we use it as a tool. It's good to use in combination. Mammogram, unfortunately, also has a lot of radiation. Each mammogram has about 300 milligrays each time woman exposed to quite a moderate amount of the radiation, where the thermography, it's very, there's no radiation in thermography. The other options, it's an MRI and breast ultrasound. as you can see, our system is a very highly endocrine system, and we have multiple glands here. So you can see we have pineal gland, parathyroid gland, thyroid gland, ovaries, adrenal glands, and all of those glands needs to work in harmony, in unison, in order to sustain the health at the optimal level. So when even one gland cannot communicate properly or does not do the work, so it can kind of create the chaos in rest of the endocrine system. And if I'm talking too fast, please stop me if you have questions. Please don't hesitate to stop me. And can you see the screen well? Can you see all the pictures?
I lost the picture.
You lost the picture?
Yeah, I don't know how to get it back.
So see if there's a symbol of the video camera and you can click on it. Sometimes you just need to activate the camera.
I'm back in the email. Go ahead, I can hear.
Okay, all right. Okay, so how do we correct all of those imbalances? The most powerful way and the easiest way is the bioidentical hormones. And I hope many of you heard what bioidentical hormones are. Please say yes if you did. Yes? No? No.
People are muted, so no.
Yes. So, and those are most powerful molecules in our body. They're part of our endocrine system. They travel via the blood and they control our differentiation of the cells, proliferation, metabolic rate. There's so many chemical reactions that depends on the amount and the ratios of those hormones. And the optimal levels are essential for health and quality of life. So what are they, those hormones? So what they are have exactly the same structure as the hormones that are produced by our bodies. You know, they are, the concept that they used by the science is to mimic the nature and use those substances to correct imbalances. And there's no side effects, there's no interaction with the medications, and there's no allergic reactions. And negative effects only with improper administration or delivery or dose, and they are non-toxic.
And that's something you do in the office, right?
Yes, and I do this in the office, and I will talk to you about how do we identify who needs the hormones and who doesn't. And why do we lose our hormones? Often patients are asking me this question, and here's the answer. So we accumulate the toxins in our tissue, our blood vessels get worn out, we don't have enough oxygen, we don't have enough nutrients, long-term stress effects, the aging process, use of alcohol and the smoking, exposure to different viruses and parasites, bacteria. So glands that produce hormones, they get worn out, and then they don't make the hormones in the optimal amount. So, and I want to emphasize too that the hormones, bioidentical hormones, it's a very common practice. It's a good medical practice. Let's look at the diabetes. You know, people actually receive bioidentical insulin that is derived from roosters. And for hypothyroidism, for low thyroid, people are getting medicated with medications such as Synthroid, Levoxel, and the Armour, and those are all bioidentical also. The growth hormone deficiency in young people, we also use bioidentical growth hormone. For adrenal insufficiencies, we use hydrocortisone, which is also replication of the bioidentical cortisol. However, for the menopause, and for autoimmune conditions, doctors do not use bioidentical hormones. Typically, yes. So most of the time it's something conjugated and altered. So unfortunately, aging is a natural process, but it's a self-destructive program that kicks in around 25. And after 25, it's going down the hill. And so what we know this from the research and the medical data statistics, that high blood pressure, diabetes, obesity, heart attacks, autoimmune conditions, all of those diseases actually increase with age, after menopause, after the hormonal deficiencies are in place. So unfortunately, aging and the loss of the hormones both are natural and bad for us. However, there's multiple studies that show that restoration of the hormones at the youthful levels prevents multiple conditions. So estrogen, progesterone, testosterone, DHEA, all of those hormones, they're not just sex hormones. They're responsible for so many processes in the body. They're responsible for function of the glands, the growth, the maintenance, for the brain function. Very often I have patients that tell me the minutes, the time when menopause came, the memory became very sluggish. The focus was the problem, because estrogen is a lubricant for the brain, for the joint. It's very helpful for the skin, hair, and the connective tissue. It also improves the insulin sensitivity. It improves thyroid function, reduces blood pressure, and prevents the plaques in the arteries.
That's estrogen you're talking about?
It's a combination of estrogen, progesterone, testosterone, and DHEA. And I will be talking a little bit more about DHEA. I especially like that hormone. But now I also want to address that so many patients with fatigue and depression and pain, anxiety, they actually underdiagnosed. They underdiagnosed with some cortisol deficiencies or thyroid deficiencies. And instead of this restoring those hormones, the patients are giving medications such as antidepressants, amphetamines, anti-seizure drugs, antidepressants, and sedatives, anti-anxiety. And if we would address and diagnose properly, so those medications would never even be needed. Thyroid sets regulations in the body. Cortisol delivers the fuel. This is why it's important to address them at the same time. Actually, I always make sure that the adrenal glands are working properly, and then the thyroid needs to be balanced after the adrenals. But as I said, they work together. Thyroid sets the regulation, cortisol delivers. Thyroid determines metabolic rate, and cortisol gives you energy. And this is why prednisone is often used for inflammatory conditions, because it has amazing effect, anti-inflammatory effect. But unfortunately, prednisone is like 10 times more powerful than bioidentical cortisol. So it's a very gradual and more natural way of addressing similar issues.
The bioidentical.
Bioidentical cortisone, yes. But you probably often heard about term adrenal fatigue. So adrenal fatigue is synonym of total cortisone deficiency or severe cortisone deficiency. Often depression, the achiness, the irritability, anxiety, all of those symptoms of low cortisol. Severe PMS, hypoglycemia, allergies, and autoimmune conditions, all relate to deficiency in cortisol. And usually it happens after person has been under prolonged period of stress. At first, the body produces a lot of cortisol in the reaction to stress, whether it's emotional stress, chemical stress, physical stress. And then after prolonged stimulation of cortisol production, the glands, like we discussed, they get worn out, and then we can't produce cortisol, and this is when adrenal fatigue is diagnosed.
And you can help that by easily prescribing?
I balance, some cases I give cortisone prescription, bioidentical, and in some cases we do it with the herbs and natural remedies. So there's a lot of good formulas that help to kind of wake up your adrenal glands and just motivate them to stimulate the cortisone. And so I do both ways depending on the condition and the symptoms.
It's much gentler way.
Yes.
Yeah.
Yep. And women have a problem. So we actually produce half of cortisol than men produce. And this explains why women don't have, actually have more incident of depression and fibromyalgia and autoimmune conditions and rheumatoid conditions, because we just cannot compensate with that amount of cortisol that men can do. And the reason antidepressant medications are working, because antidepressant increase your cortisol level. So it's like a indirect treatment, but we can avoid all this loop of taking antidepressant medication by addressing the problem.
So a lot of those medications have side effects.
Yes, lots of antidepressant medications, anti-anxiety, they affect your neurotransmitters, they cause weight gain, they cause digestive imbalances, and we want to find the root cause and don't just use the Band-Aid for the problem. All right, and here's one of my favorite hormones. It's called DHEA. They call it's the youth hormone, the most abundant hormone in young people. And so it actually converts into testosterone. It's a precursor for testosterone and estrogen, and the levels decline with age. When we're young, we have levels up to 500, and as we age, it drops to 100 to 200. And so we want to restore it to optimal youthful levels. It's great for osteoarthritis and aches and pains. It's also essential for people who take cortisone or other steroidal medications. So it offsets the effect of the steroidal medications, because the steroidal, like prednisone, the catabolic hormones. Catabolic means breaks down the tissue. DHEA and testosterone, those are anabolic hormones, and that means that it builds the tissue, regenerates the tissue, and we want everything that regenerates. It's very important to know your balance of anabolic and catabolic hormones in the body, and the anabolic hormones, they reduce the pain and inflammation. And also improves fertility and sexuality because it converts into estrogen and testosterone. So how do we identify our imbalances? We can do blood work. We can do via blood, testing via blood. We can do it via saliva or urine. So there's many different levels. We can also base the treatment empirically on your symptoms and your medical history. But it's always good to know what is the baseline and do some kind of testing. And nowadays, there's so many different independent laboratories that provide variety of kits. So you can do it at home by yourself with the finger prick or saliva or urine. And then you just send it out and we review your results when we meet.
Right, and those are kits, so they're very unique to your practice, functional medicine.
Mm-hmm. Yeah,
doctors and practitioners versus what you're going to see or what you're going to get from a traditional.
And I can do also traditional blood work, but I know which tests to choose. That I do it a little deeper. I dig deeper to identify deficiencies. Like, for example, with the thyroid problems, there's often we need to identify what is your T3, what is your T4, what is your reverse T3, what are your antibodies. And unfortunately, and I know those names might not tell you anything, but the point is that traditional medicine usually tests only one marker, and it's the TSH, thyroid stimulating hormone. But unfortunately, it's not the most sensitive marker. So I would always add some additional markers that give me so much more information about your health and about your thyroid. And with the cortisone, the best type of test for the cortisone, it's cortisol. Yeah, it's your salivary cortisol. So it's not the blood work. So it's a saliva that is needed to identify those deficiencies. I also do a variety of testing for nutritional deficiencies, and some of them are very helpful. For example, micronutrients can tell me about your vitamins, amino acids, minerals, essential fatty acids, short chain acids, antioxidants, and it's a very good way to see whether your supplements are working that you're taking, or whether you need some supplementations in general. So it's also, we can base your telomere length based on the nutritional content of your body. Another test that is very helpful to investigate digestive problems, it's the stool test. And there's a variety of them. There's a GI function stool test, there's a GI map, there's a gut zoomer, variety of different testing that can uncover so much about your microbiome, and whether you have any pathogens, and whether you have inflammation in your system, or you have leaky gut, or you have some poor diversity of the flora. And you probably heard that brain and gut connection is very important. And another very good saying, the path to health lays through your gut. Mm-hmm. Now that science pays attention so much to our microbiome, we learn that we can actually correlate certain bacterial species with predisposition to the conditions, such as diabetes and hyperthyroid or high blood pressure, different cardiovascular conditions, or mental conditions that can also be predicted based on certain bacteria.
So you're saying that if you have the presence of or lack of certain bacteria, mm-hmm. that yes. could be an indication
it correlates with certain conditions. Yes.
And that can be corrected now.
Yes. Yes, and it's like your own map of your microbiome, and we can manipulate and correct what needs to be done.
Really personalized.
And like, for example, allergies often connected to the digestive issues and the poor diversity. Inflammation can be caused by intestinal lining inflammation and the leaky gut. And in the cardiovascular diseases, yes, there's a strong correlation with certain certain decline in certain markers in the digestive tract. Okay, let's see. And of course, diet is very important, and modification of the lifestyle. So I see some people are still coming. Yes. And so I do create some tailored programs for people. For example, some people are doing really well on ketogenic diet, and some people need something like low histamine diet or low lectins diet. You know, we're also different, and we need those variations in order to improve the digestion and assimilation of the nutrients. The nutrients are building blocks for our bodies, and when we're missing something, so there's a whole chain of biochemical reactions that can be missing, and that can prevent mitochondrial regeneration and development of the disease.
So it's really the mitochondrial is that cellular health.
Yes, cellular health, because our cells replicate based on what nutrients we put in our body. Yes, and I use organic supplements and herbal remedies and the foods for correcting those imbalances, and when needed is medications, but we try all the natural options first. And so what else do we need to do to stay young? So we need to detoxify, continuing cleansing. And there's a variety of different detoxification programs. There's some tools that you can do at home, such as coffee enemas, colon hydrotherapy. There's infrared saunas, so lymph drainage, skin brushing that can be done at home. There's a very old-fashioned liver gallbladder flash. Maybe some of you try that. So I have been doing the liver and gallbladder flash since I was in my 20s. So I was very pleasantly surprised when I came to America. It was the same system. So it was very nice to know that the health has universal approach all over the world.
What is the gallbladder flush? How is that?
Gallbladder flash, it can be very uncomfortable process, and so it's inquired to drinking certain concoctions, and yes. And if anybody is interested, so we can talk about it in the future. And the juicing is another good program. But I really like some cleansing programs. Since insulin resistance is such a big problem nationally, many good companies develop very precise programs that aim to control your sugar and control your insulin resistance and provide all the nutrients for thyroid and adrenal glands and your liver. So it incorporates the whole array of nutrients in the cleansing program. And usually they can be from 7 days to 28 days. And there's a different type of program, some of them in the powder form, some of them in capsule form. So for everybody's taste, and I know some people, yes, some lifestyle. And those are very helpful to incorporate into your maybe seasonal routine. Because we are exposed to toxins on a daily basis, at work, at home, outside. Our food is not perfect. Our water is not perfect. Air. So we need to have that continuing detoxification incorporated into everyday life. And the exercise, of course, it's another very important routine to incorporate into your lifestyle for many reasons. For example, 30 minutes of exercising will improve your insulin sensitivity for the next 48 hours. 30 minutes, it's impressive. Another reason for our exercising to be good things, so we actually produce the most expensive hormone for free during the exercising, and those are human growth hormone and testosterone hormone.
Yes. Every time we come back, we eat
Somebody, I can hear someone.
All right, we'll take these.
Can you just put your phone on mute or your computer on mute? That way, I know that everyone's at home. Right. Okay. Thank you.
All right. And
so the detoxifying for exercise.
Yes, for exercising, detoxifying, and creating and generating hormones that are essential for our bodies. Yeah, and the blood sugar. Yes. And I think we're getting to the end, and I probably give you so much information now. So,
Irina, could you repeat that statement you said about exercise and insulin resistance? You said it improves.
Yeah, 30 minutes of exercising, intensive exercising, such as aerobic exercises, reduces your insulin resistance for 48 hours, meaning it balances your glucose, blood glucose, makes it more even.
Okay,
And
thanks.
yes, and also you produce a lot of different hormones when you exercise, such as growth human hormone, testosterone, and DHEA. Thus, you straighten your muscles, you improve your flexibility, and you create this emotional impact on your whole body, the positive impact. And so the hot yoga is great in addition to be very intensive and powerful exercise. It's also a great detoxification tool because it induces excessive sweating, and that is very helpful for lymph, for heavy metal toxicities, and for weight loss. So lots of benefits. It can be very intense. I would recommend to start with some low intensity yoga and then gradually increase your intensity and the heat too. And you need to drink a lot of water when you exercise in a warm environment. Yes, any other questions, ladies? I know some of you joined later and maybe you missed some of the parts, but I would be happy to review and answer any questions you have.
People are muted
I have a question.
Sure.
You mentioned advanced cardiac testing.
Mm-hmm.
What are those tests?
Yes, very good question. There's two different types of testing for cardiovascular health. The most common test when you go to your primary care provider, they test your HDL, LDL, total cholesterol, triglycerides. And it's a very basic test. So now sophistication of the laboratory is so advanced that we can actually test whether you have calcifications outside of the vessels, whether you have atherosclerotic lesions inside of the vessels, what are your particle sizes. So it's broken down into particle sizes because the total cholesterol is not a sensitive number. What we want to know whether your particles are large, small, or medium. Because what we learned now, so small particles are usually sticky and they stick on the sides of your vessels, and this is what causes the lesions and atherosclerotic conditions. And the calcifications makes them more less flexible and also prone to different type of obstruction and cardiovascular events. And the large particles, those are fluffy and large that do not stick to the vessels and as much. So we need more of the large, less of a small, and this is what I can actually test. Your ratios and your inflammation markers, those are very important, and those are CRP, C-reactive protein, and the homocysteine. So homocysteine reflects your general inflammation in the body, and the CRP reflects your vascular inflammation in your vessels. And there's a few others, but those are the most important. We can also test your genetic predisposition to cardiovascular events and genetic predisposition to the osteosclerotic lesion accumulation. So there's a variety of different markers that can differentiate that. Good question.
All right. I'm wondering if if some of the tests are the lipoprotein A and B.
Yes, and
Is that what it is that
we
you
can do A and B. So this is the A, this is your pattern, this is your genetic predisposition, and the B, it's your pattern, whether you're prone to accumulation of those lesions or not.
and those are tests that you particularly would order and look at.
Yes, and those tests actually can be ordered through a traditional laboratory. You can obtain that testing in LabCorp or Quest Diagnostics, and I can prescribe those. And most of the time, they are covered by insurance.
And I have a question for you. I have had those tested before, and I have had 2 regular doctors who did not know how to interpret the
Interpret them.
answers to lipoprotein A and B. Does that surprise you?
Yes, because unfortunately, as I mentioned, primary care providers just order that old-fashioned basic panel. And I don't know why is that the case, because insurance companies do not want to reimburse the more advanced testing, or because the doctors do not keep up with science. So one of those.
But they just literally did not know what the results meant. They just haven't been trained in it, which
It's unfortunate because yes, in the last 2-3 years, science evolved with such a speed, and you really need to be on the top of everything and attend different seminars, conferences, because since the Genome Project, the science is just boomed, and especially the medical science.
The testing.
Yeah, the testing, yes. There's so many options now. It's amazing.
Thank you for that answer. I'm glad to hear it. I also would like to know, do you believe in statin drugs to lower cholesterol?
Do I prescribe it?
Or believe.
Do you believe that that's the way to go to lower cholesterol?
No, I help people to actually reduce them and improve cholesterol naturally. One of the cleansing programs that I discussed earlier, there was actually a study was conducted, and in 21 days there was 70-point reduction in cholesterol on that program. And what I tell my patients, I give them a physiology of the statins and how they work. Statins are designed to destroy the fats, but the medications, unfortunately, are not sophisticated enough to differentiate between the good fats and bad fats. What happens, and when the person takes statins, they target all of the fats. And unfortunately, that affects us on a cellular level, because every cell of our body has a membrane that is made of fats. And they literally affect the membranes of our cells. And this is why a lot of people have side effects such as muscle ache, joint ache, and certain people with some of the genetic vulnerabilities they cannot tolerate. So to avoid those side effects, ideally physicians should do that genetic testing first to identify whether that person can even tolerate the statins or not.
Good, thank you.
You're welcome.
And I would also, what of the traditional lab tests, if you do you believe in, and do you also order? If, for instance, if we go into our normal, primary care doctor, and we just want to have lab tests done to check our health, and I'm sure you know what they order, which ones do you believe are helpful, and which ones do you not?
No, you can definitely do. It depends on what your symptoms are, of course. But CBC, CMP, at the CBC, it's a blood count, your red blood cells and white blood cells. CMP, it's a comprehensive metabolic panel, which gives you overview of your kidney and liver and your electrolytes. And those are good to do periodically. Thyroid is unfortunately not helpful because they only test TSH. So you need a more comprehensive panel to really see if there's any thyroid issues. And also symptomology should be gathered in order to correlate it with the clinical data. And then what else? The sugar, of course. The A1C is a good test to see what was your blood glucose in the last 3 months. And this is something that primary care can do. And vitamin D, D3, they can test also. And let's see, I doubt they would test CRP or homocysteine. However, those are very important. And so is methylmalonic acid. It's a representation of your B12 vitamins in the body. And also it tells me if you have a conversion problem from the homocysteine.
Terrific. Great. Thank you. Those are, I really appreciate those answers.
Yeah. Any other questions, ladies? Don't be shy. Any questions about hormones? Estrogen, testosterone, progesterone, DHEA. Those are amazing, formulas that can change your life, can transform your life within a week. I have so many people that follow me from New York and Massachusetts where I used to work, because when you try bioidentical hormones once, you don't want to stop it. So it's transformational on so many levels. Your sleep, your mood, your skin, hair, sexuality, bone density, all of that, weight, all mood, brain function, it's everything. Do you know that women lose about 5% of bone density every year from the onset of menopause? No, and the hormones can prevent that loss.
So how would you go about if someone was interested to get their levels checked? So what would be the process essentially?
Sure. So if you would like to investigate your health further, so I would be happy to assist, and you would come here as a new patient, and I would talk about your medical history in great detail, and then we will together decide what kind of testing would be the most beneficial for you and whether you have insurance or not. So we will choose the type of the test that would be more helpful for you and your situation. And then after we have the results, then I will create the treatment plan for you, whether it's nutrition-based or hormonal-based. So, but that's all tailored individually.
Are the hormones, how are they delivered? So what are some examples of what?
Good question. No, did you hear the question? Yeah. The hormones are delivered in many different ways. There's no limitations. So they can be sublingual, they can be cream, they can be vaginal preparation, or they can be oral pills, patches. There's so many different versions of, of delivery system.
And you also do, at the Center for Wellbeing, you do a 15-minute phone consultation.
Yes.
So just to see,
Yes.
maybe just explain how that works, because this
Yes.
is all, functional medicine is new. And
Sure. If you're not sure if this is something that you would like to do, so I offer a 15-minute complimentary consultation, and you can also call the office and schedule it, because I understand some people have very specific questions and individual questions, and this way we will talk one-on-one and discuss your concerns
and see how you can
and
help.
see if we're a good fit for each other.
I'd like to ask another. What is, if you start with a new client?
I need to charge the computer before.
The charger.
Yes. And plug.
Can you still hear me?
Yeah, I can hear you.
So when you start with a new client, what is typical of how many visits do you normally have with that client once you start, and before they're kind of left on their own to visit with you, once a year or whatever you like to? What's typical?
Yes. So after the first visit, so we will meet again after the blood work is done. So it can be 4 to 6 weeks. And then after the bioidentical hormones or other treatment is prescribed, then maybe a couple of months, I do another follow-up. And then if everything is balanced and normal, it's every 6 months. And again, everybody is different. I also do muscle testing. So I do individualized nutritional assessment to see how your glands are functioning and which nutrient would be the best for that type of problem. And some people like to do it more often, and some people feel balanced, and more frequent visits are not necessary.
Is it typical for a new client to walk out of there with a whole list of supplements that you have recommended?
Not necessarily. Some people come with their supplements. I usually ask them to bring the supplements with them so I can review.
Okay, but so it's not typical that you walk out and say you need this and that supplement, which is very typical if you go to a naturopath.
I see.
Sometimes.
So sometimes it depends. Yeah, it all depends, all individual.
But you don't like to really phase. What I've seen what we do is really phase in those supplements too.
Yes,
It's sort of like you try a few.
Yeah, we start with some focus problem, and then some patients, most of the time, they ask for more because they feel so good.
Right.
Okay, thank you.
You're welcome. Yeah, so any other questions?
I have a question with regard to menopause.
Okay.
Do you, in general, put through things like bioidentical hormones if people are having problems with menopause in the sense of osteoporosis or mood or memory issues or mood issues, something like that? I mean, is that a typical kind of treatment?
As I mentioned, bioidentical hormones or herbal supplementation. So some people prefer to do only herbal approach, and some people are open to bioidentical hormones. So I'm open to work with you on what is more sets with you, so more what is more comfortable for you. Yes.
So if you start a treatment plan for something like the menopause issues, does that mean you need to be on that the rest of your life? You have to stay on something?
If we're on the hormones, yes, usually, and again, some people would like to wean themselves off, but I tell my patients that when you decide not to have to live your life at the optimal wellness, then you can stop. But yes,
I understand. Yeah, it's just part of the aging process, and you're trying to slow things down and
exactly.
make.
We want to slow down that aging process. We want to reverse some of it. Yes, and the bone density can be reversed. We can actually stimulate the bone growth.
Very good. Thank you.
Yes, with the nutrients, bioidentical hormones, and exercises. Definitely.
I'd like to know, with weight gain is a very
I'll wash the dishes. I just want to know how you do it.
I was interrupted, but I'll continue. Weight gain is a very typical complaint of women after menopause. I'm just wondering, with your approach dealing with hormones and all of the tests that you do in your program, have you found that women are able to lose weight after this? Do you have a good program that helps women to lose some of the weight that just won't seem to come off?
Definitely. It's one of the reasons that women gain weight during the menopause is because of that estrogen dominance. And the estrogen deposits in the subcutaneous tissue. And the estrogen is a proliferating hormone. So it proliferates, it grows, it multiplies. And often when it's offset with progesterone, that problem kind of dissipates by itself. And plus, I often address the digestive system too. So very important to make sure that you assimilate your nutrients, because often the body deposits your nutrition because you do not assimilate the nutrients well, vitamins and minerals, and the body goes into that preservation state, and it does not lose weight, does not burn the calories. And when those imbalances are corrected, often body just relaxes and let it all go. Because progesterone is the feel-good hormone. Progesterone makes you more relaxed, happy, and makes you sleep well. And that is also a big part of it, because menopause can be stressful.
That's true.
With the weight gain and insomnia and mood problems and the hot flashes, it's very stressful.
Good. Thank you.
You're welcome. Any other questions, or we ready to conclude? Well, thank you so much for joining me, and I hope you will contact me for further questions, and I hope you learned a lot from this presentation. And if any further questions, please don't hesitate to call our office or contact us via Facebook. Thank you so much.
Thank you.
Thank you.
Have a
Thank
good
you.
evening, ladies. Bye-bye.
Bye-bye.
Thank you so much. Bye-bye.
You're welcome. Bye-bye.